Welcome. Thank you. I'm here to talk about Catholic communities during the COVID-19 pandemic. I'm not sure what kind of background people have, so what I'm going to do is say something very broadly about the nature of the Catholic community, to talk about say something about how the Catholic community has engaged with COVID, to say something about some ethical issues which have been of concern within the Catholic community, and then talk about three specific controversies that have occurred within the Catholic community in relation to COVID. So just starting off with the Catholic community. The first thing to say is that it is very big. So we're talking about 1.34 billion people, 17.5% of the world population, 1 in 6 of the world population. So anything which is said is going to be extremely partial and obviously won't be representative of all Catholics or all Catholic contexts. The Catholic Church, however, does have some centralized structures. It has a structure of authority, and indeed the longest continuous institutional government in the world, in the nature of the papacy. It also has local structures, local bishops, and also local bishops' conferences. So, for example, in the United Kingdom and Ireland, there are 3 bishops' conferences: the Conference for England and Wales, the Conference for Scotland, and the Conference for Ireland, which includes both Northern Ireland and the Republic. Also, the Catholic community includes a network of universities and academics. There is an academic side to Catholic life. There are some hundreds of Catholic universities throughout the world, thousands throughout the world, and Catholic hospitals. Indeed, taken together, Catholic healthcare is the largest provider of healthcare in the world. Again, that's an aspect of the Church's mission, the Catholic Church's mission, which is important and is also related to COVID. In relation to local churches, say the Catholic Church in England or in America, local churches tend to reflect the national character, and they both influence and are influenced by the local culture, and so local churches vary quite a lot. Important for the Catholic Church in this country, important really for the Catholic Church as a whole, is the Church in the United States. The United States is 1/4 Catholic. There's 70 million people. That makes it actually the 4th largest Catholic country in terms of numbers of Catholics in the world. 1 in 6 patients in the United States who are having medical treatment do so in a Catholic hospital. The current president of the United States is Catholic, and also of more enduring significance, the majority of Supreme Court justices on the Supreme Court are Catholic. So there's a very large influence of Catholicism in American life, but also of American life on the Catholic Church in America, I would say. In contrast, in the United Kingdom, Catholics are less than 10%. There are very few Catholic universities. There are no Catholic hospitals, really, not as there used to be. There are some which have a legacy of having been Catholic. Nevertheless, at 8.5% or so, the Catholic community represents the largest minority faith in the United Kingdom. And also, by coincidence, the Prime Minister at the moment is Catholic of a sort. So the Catholic Church in the United States and America, they're in some ways very different, but also in some ways they're quite similar and different from many of the churches in mainland Europe. In mainland Europe, Catholics tend to be, say, centre-right. I mean, there's quite a long tradition of Catholic association with Christian Democrat parties, at least from the Second World War up to the turn of the millennium or so. It was quite dominantly Christian Democrat, centre-right were Catholic parties, whereas the parties of the left tend to be quite anti-clerical, tend to be self-consciously anti-Catholic on the continent. That's not the case in the United Kingdom. That's not the case in the United States. In the UK and the United States, Catholics are minority. They're a bigger percentage in the States. They're still a minority. And they started off really quite as anti-establishment and as associated with centre-left parties. But then as they have become more establishment, they become more divided, but now I would say are roughly equally divided between right and left. So in terms of voting and in terms of politicians and in many other ways, they are roughly equally divided, both in the United States and in the UK. And that's a different kind of pattern than you find in Europe. In terms of ecclesiopolitics, because the church is also a political body, it's a human organization, and so it has its own kind of politics. The politics of the church is shaped very much by the interpretation of the Second Vatican Council. This was an extremely important group, gathering of bishops from 1962 to 1965, and it orientated the church towards engagement with the modern world. And how you understand the Second Vatican Council and how much you're in favor of more engagement with the modern world or more modernization, or more critical of some excesses of how the church should engage with the modern world, really that sets the sort of internal politics of the church throughout the world, but particularly say in Europe and in the United States. This combination of factors leads to a phenomenon, particularly in the United States, where you have some conservative lay Catholics who are critical of their leadership, of the bishops, as being too progressive, and also who are critical of the Pope, the current Pope in particular, as being too progressive. So there's a sense in which sometimes it's thought that the leadership might be associated with more conservative sort of views, and well, the people in the pews might be more liberal, and that can be true, but the opposite can also be true. You have quite a large group in the States, in particular, of self-consciously assertive conservative Catholics who are lay people, who are critical of the people who represent them, are critical of the bishops, and critical of the Pope being too progressive, and that's shown in many issues, but it also had repercussions in relation to COVID. So how has the Catholic Church and how have different Catholic communities engaged with COVID? Well, by and large, Catholics have followed their bishops, and bishops have followed governmental and public health advice, by and large. The Pope in particular has been extremely active, encouraging cooperation with public health advice, in encouraging the move towards lockdowns and conformity with lockdowns, and encouraging vaccination. Almost, you might say, evangelical about this, the public health moves to try to combat COVID. Within the context of the church, there has also been an emphasis, I think, on the work of priests and of hospital chaplains in the context of the pandemic and their importance, but also of the importance of lay Catholics working in healthcare, either in Catholic institutions or in non-Catholic institutions, say in the NHS in the UK perspective, that the work of healthcare is itself a great Christian work which we ought to support and be celebratory of. So all of those, I think, are sort of common in terms of Catholic reactions. In terms of the significance of chaplains and priests, an instance might be found in northern of Italy. In the first wave of the pandemic, Italy was hit particularly hard. There were very many deaths, including many deaths of priests. There were some dozens of priests who died in the north of Italy in that first wave. And this was regarded as a sign, in a way, of the church's identification with and solidarity with those who are suffering and suffering alongside them, and being a sort of spiritual sign alongside those who were suffering from the pandemic. And there was one particular story, which is not typical, but it's sort of illustrative of the, I suppose, an aspiration for how the church sort of understood what was going on, the suffering at the time. There was a priest in the north of Italy who got COVID. He got COVID because many of his parishioners did, and he was visiting his parishioners. He was in need of ventilation, and he decided to forego ventilation so that the ventilator could be used for somebody else. And he subsequently died of COVID without the support of a ventilator. And that was sort of held up as an example of the priests alongside people and being vividly aware of the suffering of the people with regards to the pandemic. And so and all of that was very, very positive about healthcare, positive about the sort of the potential, at least, sign, witness of spiritual accompaniment. But while that was true, there were also criticisms within the Catholic Church of some responses to the pandemic. And the Anscombe Bioethics Centre, of which I'm a director, we produced a series of briefing papers on ethical issues related to COVID. And these briefing papers started with one on allocation, and particular allocation in relation to ventilators, because there was a concern that though the issue of healthcare allocation is always with us, in a pandemic it becomes more acute, and the danger is that actions are taken which reinforce discrimination, and that though you need to have rationing and you need to have triage, you also need to have it in a way which is fair and just and transparent, and that wasn't always done, or at least there was a concern that wasn't always done, and that was raised in particular within the Catholic community. And related to that was a criticism of the use of do not resuscitate decisions, do not attempt cardiopulmonary resuscitation decisions. And in particular, that there was sometimes or it was alleged that was a blanket policy of putting DNA CPR for adults with learning disabilities, which is completely against the proper guidance for these things, and is also discriminatory, and is an example of a sort of overreaction in the context of a pandemic in a way which was discriminatory. There were also concerns about that lockdown itself may have effects, that if as it were, the disease causes harms, but so does the treatment. And if the treatment is isolation, then isolation particularly hits those who are elderly hard, but also it hits those who are dying. And there was a concern, and I myself have in terms of the lessons that we should learn for next time, if there is a next time. One of the things which was I don't think was done well was the way in which people were excluded from being in the presence of the dying, so that the accompaniment of the dying person, not just by healthcare professionals and not just by priests, but by their loved ones, that was very often excluded by restrictions, and I think the significance of that was sometimes understated. I mean, given that people can wear protective clothing and that kind of thing. So there were ethical concerns about the pandemic, how the pandemic was approached, which I think was common across the church. But there were also some issues where the church was not united in a positive way and not united in its concerns, but where there were tensions within the church about whether the right approach is being taken. And I want to highlight three in particular. The first was the shutting of churches and the timing of that. The second is the relationship between COVID vaccines and abortion. And the third related to that is the imposition of vaccine mandates. And in all three issues, you have quite deep divisions among Catholics about what was done and how it was done. So in relation to shutting churches, the first thing to say is that Catholics are under an obligation to attend Mass on a Sunday. It's one of the 6 chief commandments of the Church. It's a very strict obligation, traditionally, an obligation which binds under sin. It's very deep in Catholic culture. And the response of the vaccination and the way in which the church went along with the response meant that this obligation was lifted. There was no longer weekly worship, but also churches themselves were closed even for private prayer. Many, particularly again lay people, thought that the churches should have pushed harder to prevent this or delay this or minimize this. And as an example, there's a conservative journalist, commentator, Damian Thompson, who's a Catholic, who writes in The Spectator, a conservative-leaning weekly journal. Back in April 2020, he co-wrote an article called "Have the Churches Been Betrayed by Their Bishops?" And the article was about the way in which the bishops had very swiftly closed the churches, including for private prayer, and that they seemed to have been keener on closing the churches even than the government was. That the bishops were working to a sort of public health agenda, whereas Thompson and others thought that the bishops should have been pushing for the spiritual goods and letting the government push back on public health and come to some kind of compromise. But they thought that but Thompson thought that the bishops were sort of doing the government's work for it and were too keen on closing the churches even unnecessarily. And so there was a feeling of betrayal, at least by some Catholics, in the way in which the leadership of the church had cooperated with this closing of churches during the pandemic. A second issue, and an issue which is quite, it's not only Catholic, but it was more prominent in the Catholic Church than I think elsewhere, is the relationship between vaccines and abortion. Most vaccines for most diseases, not all by any means, but most, have either in their initial research and development or in their manufacture or in their testing made use of cell lines which are taken from cells which were taken from an aborted fetus. In particular, the cell line HEK293, HEK293, which is a very commonly used cell line in biotechnology and clinical medicine. HEK293 is a cell line from a kidney. That's what it stands for, human embryonic kidney, a cell line from the kidney of a child who was aborted in 1973 in the Netherlands. And so the question is, by using vaccines which have been developed using HEK293, are you somehow complicit in abortion? Now, this was a question. It wasn't new in COVID. It was looked at a very high level back in 2008 and previously also in the 90s. And the Pope and the Congregation for the Doctrine of the Faith, which is a kind of policeman, guardian, if you like, of orthodoxy within the Catholic Church, they both stated that to use a vaccine which was developed using HEK293 or similar things is permitted because it is, though it is a form of cooperation, and it is a cooperation with something which is wrong, the form of cooperation is remote and material. It's not something where you agree or even implicitly agree with the way in which this material was taken in the first place. So Catholics can, if they follow the Pope, Catholics are permitted to use vaccines which were developed using tissues from an abortion. However, others who want to raise this issue say, well, even though it is still acceptable in principle, we should avoid it if we can. We should avoid tainted vaccines if we're possible, and therefore we should also demand a choice of vaccine. And we should demand, so for example, between Pfizer and AstraZeneca, AstraZeneca was more complicit in abortion. Aborted derived tissues were more involved in the making of the AstraZeneca vaccine than in the Pfizer vaccine. So Pfizer is less tainted in that respect. And there are some vaccines, including the Chinese vaccines, Sinovac, which have no use of fetal cell lines at any stage, and are, from that point of view, if you wish to use a vaccine but have no complicity in abortion, there are alternatives. So we ought to be making use of those alternatives. That was a sort of argument that some people made, and so they were dissatisfied with the leadership for being too compromised on this issue. And lastly, and somehow related to the first, there's a divided view in relation to vaccine mandates. Abortion-derived concerns aren't the only concerns in relation to vaccine mandates. Vaccine mandates are the imposition or the requirement of a healthcare intervention, and in requiring a healthcare intervention, that undermines the freedom of consent, which is usually the ethical sort of a fundamental principle of healthcare, that you don't impose healthcare on someone without their consent. So it's sort of coercive healthcare. And so the general view among most Catholics, or at least among most academic clinicians who are speaking about this, and bishops' conferences who are writing about this, have been supportive of vaccines, but critical of vaccine mandates. That has been the typical kind of view. But there have been some who have been in favor of mandates. And indeed, the Vatican itself, the Vatican as a state, the city-state of the Vatican, instituted a vaccine mandate for people who worked there. This was not instituted by the Pope, it was by the Secretary of the State of the Vatican, who's a sort of bureaucrat, really. But even in the Vatican, there were people who were in favor of mandates, and one was instituted in December last year. I'll give another instance. The Anscombe Bioethics Center, which I run, we have an annual lecture, which is our kind of prestigious lecture of the year, event of the year. And last year, because of the importance of COVID, we invited Professor Nicanor Austriaco, OP, to give the lecture. Now he's a Catholic priest, a Dominican, and he's professor of biology and professor of theology in Providence College in the United States. And he is also professor of biology and also professor of theology in Manila, at the University of St. Thomas in Manila in the Philippines. And he's Filipino. So he spends his time between the United States and the Philippines, and he's a professor both of biology and a working biologist, and of theology and moral theology in particular. And within the Philippines, he was very heavily involved in the scientific response to the pandemic, and was on the equivalent of their equivalent of SAGE, so giving scientific advice to the government about these things. And he gave our lecture, and in this lecture, he defended vaccine mandates on the analogy of conscription. And he said military conscription it would be wrong to have military conscription all the time, but if your country is threatened by being overwhelmed, then in emergency situations you might reasonably have conscription. And it's similarly in an emergency situation, when you're being overwhelmed, you might reasonably have a kind of healthcare conscription, and that's what a vaccine mandate was. So that was his argument. The Anscombe Bioethics Center hosted this event, we hosted this lecture, but we took a different view. I took a different view, and so did the center as an institution, and we opposed this, and we thought that it was unethical to require vaccine mandates, either in healthcare or in the population generally. But this, the fact that he defended it shows that, I mean, there is a division of opinion among people who are very involved and very committed to the Catholic faith, and very committed and who were working in this area. So there were divisions. I say the mainstream, in my view and my reading, the mainstream Catholic reaction has been in favor of vaccination, but not in favor of mandates. But there have been some who are in favor of mandates. Of those who are opposed, it's also true that there are some, particularly in the United States, that veer towards the anti-vax movement. So there's an overlap between the anti-vax movement and some Catholics. And the link between vaccines and abortion and the opposition to vaccine mandates have both encouraged anti-vax sentiment among sort of Trump voting Catholic Americans who are conservative and who are anti-establishment, and who are distrustful of the establishment and distrustful of their bishops. And among that group, there's a sort of overlap. But neither they nor the people who are in favor of mandates represent the mainstream. I would say the mainstream is between those and encourages vaccination, but doesn't wish vaccination to be mandated, but thinks that's liable to be counterproductive. So in summary, there have been divisions within the Catholic Church on some issues, and these divisions generally have reflected pre-existing political and geographical and ecclesial divisions within the Church. And in particular, there have been criticisms by some conservative Catholics, and I associate this, as I say, particularly in the United States, but you do see it here also, but not to the same extent. So criticism by some conservative Catholics of the leadership of the Church, of the bishops, for being too worldly, too progressive, taking on board too many of the restrictions of the pandemic without pushing back and representing a different set of values, a more spiritual set of values, and so on. So there has been some tension within the Church over COVID. And there has also been a shared concern, which is not one-sided, a shared concern sort of, I think, throughout the Church, that not all of the response to the pandemic has been fair or just in relation to access to healthcare. So there's been a concern about justice and discrimination, and that's been something which is common. But I would say overwhelmingly and predominantly, if I were completely, again, rashly to try to summarize the attitudes of a billion people, but I would say the predominant attitudes have been solidarity with those who suffer, support for healthcare workers, broadly support for public health measures and vocal support by bishops, and at the same time an appreciation of the need for spiritual care alongside physical care during the pandemic. This goes with, as I say, particularly the suffering of the pandemic and the sort of double suffering of what it is to die in isolation in the context of a pandemic. And there's been a great awareness of that. And with that, I finish, and I hope that we have some time for questions.